There we go. So I always like to start these presentations by just looking at a scenario. So something that we see in our state. And so we're going to go through the scenario together. I have some questions after I read it, and you can go ahead and respond to those questions by either dropping your thoughts into the chat box, or you're also able to use the raise your hand emoji and bring yourself off mute. So Ian and Betsy are going to be helping me monitor the chat in both ways. And throughout the presentation, if you have questions, feel free to use one of those ways to ask the questions as well. So the client scenario we're looking at today, Suzanne is a single parent who is struggling both financially and emotionally. She and her 3-year-old son, Robbie, are living in a studio apartment without running water after leaving an abusive situation. Suzanne was furloughed from her part-time job early in the COVID-19 pandemic and has been able to get by on a few $100s that the government was sending each month. Recently, Suzanne was notified that these benefits have ended. Suzanne doesn't know where to find a job that will pay enough for their basic needs and isn't sure who would be able to watch Robbie if she wasn't working anyhow. She is feeling hopeless and is fearful she will lose Robbie if conditions don't improve. So that's the scenario. And we're going to go ahead and talk through some of the main points here. And the key points of the scenario are off to the right of your screen, so you can refer to those at any time. But first, I'd just like to ask, if we can help identify some of the key issues that this family is experiencing. So go ahead, drop those in the chat, any key issues that you can identify that are happening for either Suzanne or Robbie.
All right, seeing a couple answers come through in the chat here. We have no running water or daycare, emotional trauma, health and safety issues with no running water, food insecurity, mental health resources, loss of income.
Great. And then what are some appropriate providers or resources that the family could connect with? And I know depending on where you are in the state, this might look very different, but go ahead and just type in anything that comes to mind, somewhere that could help this family.
Teresa is saying WIC or SNAP. We have WCA, Jesse Tree, Catch 211, faith-based charities, Idaho Legal Aid Services, Idaho Housing and Finance Association, Giraffe Laugh.
Great. And I know there's a lot of experts on this call, so I'm sure we could go on and on all day about the great resources that we all know in our communities. But let's talk a little bit about what happens next. So what does Suzanne actually have to do to find help? Or how do referrals happen within these organizations?
Seeing a lot of call 211 in the chat here.
Okay, so she would call 211, get some phone numbers or addresses of places to visit.
Teresa says use Find Help resource. I like that one.
Teresa, you're on Team Find Help. We appreciate that. And what do we know about the kind of follow-up that occurs? So let's say Suzanne makes some calls, she visits some resources. What kind of follow-up happens after those initial instances And it's okay if you don't have a lot of answers here. Oftentimes this one is a question that stumps the crowd.
So we're getting a few answers coming through the chat, lots of phone calls and running around to various resource offices all over the place, varies from org to org. We don't know, I like that one.
Great. Well, thank you all for participating and for your feedback here. Again, we know a lot of people on the call are experts. You have a deep understanding of how to connect people with resources, how to follow up with them or make referrals. Maybe some of those is the warm handoffs between organizations that you're already involved with. But in Suzanne's situation, we know oftentimes, let me see if I'm going the wrong way here. So oftentimes in Suzanne's situation, it feels like this. So it's really hard to navigate the system, especially when you're in crisis. For Suzanne, she might be looking to just put a Band-Aid on her most basic of needs. So we know she doesn't have running water. She might call the utility company, try to find out if she can create a payment plan to get it turned back on. Maybe she takes out one of the high interest paycheck loans to try to get some cash influx to solve some of these immediate needs. But in the end, it's a lot of time telling her story over and over and running into barriers across the way. So sometimes we know that there's a resource that can help her, but they don't have funding right now and she's just going to be put on a wait list. Or maybe her financials are just a little too high to actually qualify for a program. So we know there's different barriers along the way that keep people seeking resources from actually connecting with the programs that can serve them. So FindHelpIdaho.org is trying to make this easier. So our goal is to connect people with the programs that can serve them in this straight line approach. And there's some ways that we're able to do that. One is by making it a zip code search. So we're pulling in resources that are really relevant to people seeking information. We make it easy to browse through social service categories and connect directly with the programs that fit the seeker's need. A couple of great benefits about using FindHelpIdaho.org. So it's free. It's completely free for anyone who's seeking resources to jump on and use the site. It's free for nonprofits to be listed on the site and to use any of the tools that I'm going to share with you today. It's private and secure, so HIPAA, FERPA compliant and high trust certified. We know it's being used in some of our hospitals across the state and school districts, so you know that they have the utmost confidence in the security measures offered. And then relevant, easy, up to date. The resources in FindHelp are updated every 6 months. So the FindHelp data team goes in on a rolling basis. They contact the services, they make sure the phone number, address, website, all of that information is still up to date, and that the program information is connecting people who need the resources by putting in really detailed descriptive and keywords. We couldn't do this alone, so I'm with United Way of Treasure Valley. United Ways across the state are partnering along with some of our great nonprofits like the Idaho Food Bank, the YMCA, St. Luke's, St. Al's, Genesis Community Health, Idaho Nonprofit Center. But the main one is the Idaho Health Data Exchange. So they're actually who makes this resource possible in our state. They purchased the license, seeing that there was a need to connect people with health services to keep them out of the emergency room. And once they got into the site and were using it for their purposes, they realized that this really was a resource that could be spread wide. And they connected with United Ways to bring this to the state of Idaho. We're the only state that's actually looking at this as a statewide resource. So in other areas, Find Help is in certain cities. It's a nationwide platform, but here in Idaho, we're actually looking at it as a resource for the entire state. I'm going to share a video now, and this is a very high level overview of all of the tools in FindHelp.org. In this basic navigation session, we're not going to be able to dive into all of them too deeply, but most of them we will see if you stay on the call from noon to 1. Sorry. Okay, so that again was a very high level overview. I'm now actually going to jump over to the FindHelp.org website so that I can share a live demo with you of all of the great tools and show you how basic resource navigation works on the site. Okay, is everyone now seeing the FindHelpIdaho.org landing page? Great. So this is FindHelpIdaho.org. Again, this is the statewide site that is powered by FindHelp. What's great about FindHelpIdaho.org is that we have some ability to add resources into the site that are specific to our state. So in the state of Idaho, as an example, we've placed a priority on mental health services. We have more mental health services on FindHelpIdaho.org than you can find through the regular FindHelp site. And I do want to mention, some of you may have known this site previously as Aunt Bertha, or maybe if you're up in North Idaho, you've used North Idaho Connections. All of those sites are doorways into the same house of resources. So no matter where you enter into FindHelp, you're still going to be interacting with resources that are local, relevant, up to date. FindHelpIdaho.org is the doorway that we're encouraging people in our state to use. And you're going to see a lot more information about this out in the public soon. It's a new resource and the public launch is actually happening on April 6th. So this is kind of a little sneak preview for everyone on the call. You'll see on the homepage here that you have the ability to select a language. So you're able to select from more than 100 languages. It translates the pages using Google Translate. Once you make a selection, it's going to carry that language selection with you page by page. So you only have to make it once. And if you choose to email the resources, print the resources from the site, it will translate them into that language when you are doing anything on the site and interacting with it. Here on the top, you'll also see we have a button to the prepare tool. So this is a question I get asked a lot. What is prepare? Is it spelled incorrectly? It is not. It is an acronym that is used by our healthcare providers. And it's actually a tool that's designed to help and assess the needs of individuals to connect them with community and social services. So it's a tool if people don't really know where to start or what help they need. It's a survey that can ask them about their basic needs and then suggest some resources in the state directly to them. So if you know someone that's working with the site and maybe they're a little less technology savvy, that's a great tool. I'll go ahead and just open it so you can see what I'm talking about here. But it's a great tool just to assess your basic needs. Again, you're able to select what language you would like. It's going to ask your zip code so it can pull in really relevant resources. And then it's going to ask you some basic questions here. Once you submit the survey, then FindHelp will follow up with you directly within 48 hours to suggest some resources to connect you with. Back to the main page, you're going to see it does ask for the zip code. Again, that's going to pull in the closest resources to you. And I'm going to go ahead and log in. Best practice is to create a login, especially if with a community-based organization. Individuals can also create a login. It's completely free, and numerous people at your organizations can have logins to FindHelpIdaho.org and work within the tools to share notes with each other, share referrals. And so the more people that are using the site, the more data you can share and the more you can pull out of it. You can do everything completely anonymously, though. I do want to stress that before I log in. The basic resource navigation can be done without providing any personal information or without creating an account in FindHelpIdaho. All right, so I'm logging in. I'm going to show you how the homepage changes. So now I've got program tools available for me. So program tools, you can track inbound referrals, view program analytics, update your program information, manage and work within your team, see the people you're helping, and get additional tutorials and trainings. Yes, Ian, I see your hand is raised.
Yeah, we had a question in the chat, and I hope I pronounced this right. Tiana is asking, is the Prepare tool also accessible in the 100+ languages?
It is, yes. So with the program tools, I'll get into all of those a little bit later, but they are available to any community-based organization that has a free or reduced cost service that is listed within FindHelpIdaho. So we're going to start with a basic zip code search. I'm going to use a Boise zip code because I'm in Boise, but know that you can actually use any zip code in the entire nation. You're going to see that more than 1,800 programs pull in for the Boise area. So this includes local programs. It's going to pull in regional programs, statewide programs, and national programs. Something that's great about FindHelpIdaho is that it doesn't stop at the Idaho border. So we know sometimes the closest resource is actually in Oregon, or if you're in North Idaho, maybe it's in Washington, maybe it's in Montana. Those programs are still going to pull in as resources for people who live or work in Idaho as long as they serve our state. Once you're in the search function, you can type in keywords or program names if you already know what you're looking for. Or you can use these icons at the top of the screen to further filter your search. And I really like the icons because if you think back to the example of Suzanne, she may come to a resource like FindHelpIdaho thinking that she's looking for one thing, but then when you get into the database, you can see, oh my gosh, there's all these great resources available to me. And you can kind of take the lead on your own navigation, check out the different services, and find what might help you through the crisis that you're in. So again, in Suzanne's situation, we'll look here under housing, and under help pay for housing, we have that help pay for utilities category. So it pulled in 26 results. And through here, you can add more filters. So there's a personal filter. You can look at things like age, if you're in the military, health or housing concerns, program filters. Everything in FindHelp is free or reduced cost, but if you need it to be completely free, there's an option there. And then income eligibility, especially for some of the statewide or national programs, people often wonder if they qualify. Putting in the number of family members and amount made per month can help you filter the search that way. You have a mapping tool over here on the left. So you're going to see where the resources are on a map. That's really helpful if you want something that's near your home or maybe on your way home from work. I'm a visual person. It helps me a lot more to see it on a map than just to know it's 2 miles away. For each and every program in FindHelpIdaho, they're going to have a program card created. So you're going to see St. Vincent de Paul here has a program card. They have a check mark next to their name. That means the program has been claimed by St. Vincent de Paul. And I'm going to get into how to claim in a moment. But basically what it means is someone who works at the organization has gone into FindHelp, they've created their free account, and they've claimed the program, saying that they're able to provide information for anything that lives in the program card. And you'll see when you open the more info button that it's a lot of information. So it has eligibility, if the program's available, if it's on wait list or it's full, it's going to be listed there along with a big red listing here on the main program card. Then it has a description of the services, languages offered, cost, links to their website and social media pages, and locations. So if they had more than one location for this program, additional locations would be listed here. You can also see their hours of operation. Now, some tools that are available for you right from this program card listing. Once you're logged in, you have the save feature. So you can save to a favorites folder. And these folders are really great because you can share them within your team. You have the ability to print things that are listed in your folders. And you can also email your folders out. So if you are consistently referring people to the same set of programs, you can have all of those resources saved into a folder for ease of access. You have the share tool. So you're able to send this program card by email. You can send it as a text message, or you can share on social media. When you send it by email or by text, it's coming from FindHelpIdaho. So you don't actually have to provide your personal email or your personal phone number here. It's never going to share that information when you send that to someone. It's going to keep your information confidential. You have the notes tool. This is for you. So notes are personal. They're not something that's going to be posted on the FindHelpIdaho website. You can save notes for yourself, or you can share them with your team. So if you know that there's someone that you want to ask for at this program, or if you know that the best time to reach them is actually at 4 p.m., something like that, you can add a note for yourself. That way you can refer back to that note anytime you're looking to refer someone to the program. You can also suggest edits. So this is where FindHelp becomes kind of a grassroots effort. We're asking the community to let us know about any missing or out of date information. So you would just send a quick message. This could be something like, I noticed they said they were closed on Sunday, but they're actually now open for limited hours. You type in the message, send it over to the FindHelp data team, and someone's going to be following up within 48 hours to the organization to verify the suggestion and implement it within FindHelp. Ian, I see your hand raised.
Yeah, we got a few questions in the chat. I think some of these you're going to get to, but I'll read these off here.
Okay.
The first one is this site usable with a screen reader for folks who are blind or low vision?
Yes, absolutely. Accessibility is top priority for Find Help. So at the bottom of any screen within the program, and sorry, this one's a big one to scroll down, but there's this accessibility link and you're able to choose how you need to interact with the site. But I do know that they have, they've thought through some different barriers of interaction and that they do have the screen reader capability.
Awesome. The next question here is, how often is a program's status updated? And can an organization update their program information in real time, for an instance, if they're closing their waitlist?
Yes, absolutely. And we will get into that a little bit later. But once you claim your program, you have access to update any of the information on your program card in real time.
Great. And then our last question, if someone wants to respond to a text, how does the message get to the appropriate people?
That's a really great question. So we'll get more into the actual referral process in a moment. If you share a listing via text, it's really just sending the information of the program card to the person. It's not a text message that they can reply to, unfortunately, but it's a really great way to get information to someone who maybe doesn't have an email account, or they just feel more comfortable having it on their phone so they can access it without the internet. Okay, so I know we're going to have a few more people joining the call soon for the next session. So I did just want to show you one thing before we dive in deeper to all the resources that are available. And that is best practice here. So when you're looking at resources, whether you're navigating the system yourself or you're helping someone else navigate, best practice is to select the check mark to the left of the listing. As you go page to page looking for additional services, those selections are going to travel with you. So you'll see I'm going into food assistance now, and the selections are staying in the yellow box at the bottom of my screen. Once you have all the selections that you need, so all of the programs that you think are going to be helpful, you can find those selections all in one place. You're able to save these if you do have an account. You can email them or print them. And I'm going to show you the print screen because I think it's pretty powerful. It pulls all of the programs into one place where you can print the information. So you're basically creating a self-rescue manual that's personalized to you or the person that you're helping. All right, getting back into the referral. So I think we've got a couple more people who have joined the call now. Well, if you're just hopping on, we're talking now about the referral process, how to actually make a referral through FindHelpIdaho. So let's go back to our utilities, thinking back through our scenario, Suzanne. All resources in Find Help are going to tell you the best way to interact with the listing. We are hoping that most people turn on the one-step referral. St. Vincent has it on. In this case, it's one step to refer someone to the program. So you're saying you're referring for yourself or someone else. You're going to type in some basic contact information for them. Confirm that you have their consent to share their information with the organization, and then send the referral on. And what that does is it sends this information to someone at St. Vincent, the person who said, I would like to receive referrals about our home visit program. And it allows for them to follow up with the person seeking help. So when you think back again to that scenario of someone looking for help, they're in crisis and they're finding barriers along the way, imagine how much relief you would feel if someone called you and said, I heard you were looking for help. We have services we can offer you. So the idea is to use the one-step referral. It's available to log referrals for any of the programs within Find Help. Now, in some cases, they prefer that you contact on their website. maybe they already have a form on their website, they're going to encourage you to apply directly on their site. So each and every one is going to tell you how they would like to interact. But even if they're suggesting that you interact in another way with them, there's always this option to log a referral. In this case, the form is not being sent to the program, but it is logging it for your information. So you're going to be able to see that you suggested this program to someone. You're going to be able to see if they were able to get the help they needed through the closed loop referral process. So I'm going to dive into some of the tools for community-based organizations now. And I wanted to start with kind of the most basic, which is claiming your programs. So if you're a community-based organization, you offer free or reduced cost services, you should have your program listed on FindHelpIdaho, and you should go in and claim your program. So if you're looking in a zip code and you're noticing like, hey, our program's not offered on FindHelp, or I am not noticing a program that we interact with listed on FindHelp, that doesn't mean that it shouldn't exist on FindHelpIdaho. It likely just hasn't made it on our radar yet. So we'll talk about that in a moment as well, how you can suggest programs. So the first thing is claiming your programs. At the bottom of any screen in FindHelpIdaho, you have the claimed programs button right here, next to the accessibility button that we talked about earlier. It's going to ask you a few basic questions, the name of the program or agency you work for, and the zip code, which is optional. So let's say I work at YCAP. You don't even have to type in the zip code. It's going to search for anything. So it is pulling up all the possible matches here. Now, if I worked for YCAP for real, I could click this blue claim button saying, I work at this organization. I would like access to the program card, to the tools in FindHelp. I want to be able to work with my team within the platform. And FindHelp is going to follow up with you within 48 hours to confirm your employment with the organization and add you to the program card listing. So if you are creating an account, best practice is to use your work email, especially if it has, like mine does, unitedwaytv.org at the end. That's going to help the verification process move along a lot quicker. I'm not actually going to go through the claim process because I don't work for YCAP, and they'll just contact me and tell me that. But this is how you find your program. So you also want to be claiming multiple programs. So the provider is the organization. The program name is the service offered. So if you're involved with multiple programs within your organization, go ahead and claim any that are applicable to you. Let's say you go through this process, you're noticing that your program's not listed. Again, bottom of the screen, any page within FindHelpIdaho, suggest program button. This button is going to do a quick search first. So they just want to verify that your program does not actually exist within the database already. So they're asking for the provider name, the state, phone number, website. It's going to do a quick search. And if your program is not listed, it'll ask for a few more details. You're going to submit the program to FindHelp. Someone will be in contact within 48 hours to confirm all your information, build you a great contact card within FindHelpIdaho, and get you up and running on the site. If you have more than 10 programs to suggest, there's a button for that right here. It's a nice little Excel spreadsheet that's going to open, and you fill out all the information there. I see we have a hand raised.
Yeah, quick question, just to clarify, so multiple people within the same program can claim it?
Yes, absolutely. So that's actually the best practice. I'll show you in a moment, but there's tools that you can use within your team, and you can assign who that has claimed the program is actually receiving referrals or is being contacted about the program. So just because multiple people claim the program, they're part of the organization, that doesn't mean that all of you are going to get contacted anytime someone's referred to the program. So I know a lot of times we'll have CEOs who are like, this is great, I want to be part of it, but I already get too many emails and I'm in too many meetings. You're not going to get emails every time someone's referred, but you are going to have the tools available to you that I'm showing, and you're also going to be able to work with your team within the FindHelpIdaho platform. So that is how you claim or suggest a program. I'm happy to share out like a one-sheeter that goes through the step-by-step process on that. So I'll get that to Ian and Betsy and have them share that out with you along with the slides today. It's really easy once you're in there to do the claim and suggest process. So back to our main page, let's dive a little deeper into the program tools. So program tools here, you're looking at inbound referrals, editing your program listing, interacting with your team, and viewing program analytics. So let's look at edit program listings first. I think this is probably the tool that's used most often. We know that one of the main concerns that nonprofits have in Idaho is that when they're listed in a resource guide or listed with 211, that oftentimes their information is changing and it quickly becomes out of date. And so this brings that back into the organization's control. Anytime you have an update to make, you can make it through FindHelpIdaho. It's going to update in real time to the site. So looking at contact settings first here, this is how people are interacting with your program. So if someone's interested in your program, how should they connect with you? That one-step referral that I was showing you is what is on our program. So we want to have their name and basic contact information sent through the FindHelp site to our organization. When a referral is made, it's coming directly to me. So you're going to see my email is listed there. This email is not being published anywhere on the FindHelp site. It's just letting the database know where to direct those emails. Now, maybe there's multiple people at your organization who should be receiving referrals for your program. You just go ahead and type in their email as well. And now referrals are going to be sent to 2 separate people within the organization. This can also be changed at any time. So if someone is on maternity leave, a long vacation, you can change this to someone else, making sure that those referrals are not going to an out of office or to an inbox that no longer exists. Some other tools that are available, you can ask people to visit your website. Again, if all the information they need is already on your website, that might be a good option. You can have them schedule appointments through FindHelp. This is a more detailed process where someone from the FindHelp data team is actually going to connect with you and get your Outlook calendar uploaded onto the FindHelp site so that people can schedule appointments directly through the site. So that's not something that you're able to do manually through the FindHelp website tools, but someone from the data team would follow up to get that set up. You can have them fill out an existing application or contact form, or you can create a custom screener right here in FindHelp. And I'm going to show you what that looks like. So this would make it a 2-step referral process. Step 1, basic contact information. And then step 2 would direct them to this form. You're going to gather some more information about the person seeking services, and this application is going to be sent in along with their referral through FindHelp. So if you already have a paper form or a form in like a Word document that you're using to screen people each and every time they apply, you can easily customize and bring that form into this virtual platform, giving it a title, asking eligibility, living situation questions. And for each section, you're able to add custom questions. So whatever you typically ask, you're able to import it here. And then you can look at all these different fields of how people can interact with the questions. So maybe you have multiple choice checkboxes where you're asking what are their, most areas that they need help in, whether that's food insecurity, help paying for gas, help with transportation, childcare. You can have those multiple choice options. and you're always able to preview your custom screener before you publish it. So that is under contact settings. Once again, that's how people are interacting with your listing. Hours and location, this is where you update those most basic details about your organization. So where you're located, what languages you support, and the hours of operation. If you have more than one location for your program, you can add the location here. So if you have multiple locations for the same program, we say best practice is to just add a new location rather than listing them as separate program cards. The final tool under Edit Program Settings is actually looking at your program. So when we went onto the contact card and we expanded the more info section, this is where you edit all that good information. So you're looking at the main phone number, email, program description, even secondary services you provide. So if your main service is a preschool program, but you have a food pantry available for people who attend your preschool, you can add that in as a secondary service there. You can say who you serve. So if there's certain demographics, this is what populates in the search tools. So when people are getting down to those specific filters, this is where you set those parameters. Whether you're free or reduced cost, and the email address if people would like more information. You can also add eligibility rules here. So if you do have income eligibility or other eligibility requirements, that would be the place to save those changes. Again, these edits can be made at any time. We know that your programs are constantly changing. You're getting grant funding, exciting things are happening. So feel free to log in and update those changes at any time. And that starts the 6-month timer once again. So if your program's up and listed, nothing's changed, every 6 months, someone from FindHelp will be following up with you just to verify the information. Ian, I see there's a question.
Yes, so Lynn is asking, will there be a fee for this service?
There's no fee for this service. So all of the tools I'm showing you today are completely free for community-based organizations that offer free or reduced cost services. And those tools, again, we're really grateful to Idaho Health Data Exchange. They purchased the license for our state and have made these tools available for free.
Awesome. And we have one more question in the chat here, Anne. Has there been a dedicated training for statewide centers for independent living and other disability advocacy service providers?
There has not been a targeted training for that. That is a great suggestion. We are working to roll out FindHelpIdaho to our state in the most effective way possible. So if you have good contacts for that or want to talk offline about how best to set up a training like that, I would love to chat with you. At the end of the training, my contact information will be up on the screen, but definitely I am a tool and a resource for all of you on the call today. So please know that anytime you have questions or need additional trainings or have ideas about how we could expand this in our state, I am open to hearing all of those suggestions and working with you. Okay, my program tools. Next, we're going to look at my team. So this is how you're interacting with your team members who also have a free account within FindHelpIdaho. So you're going to see under our United Way program, we have a couple of different people who have accounts here. And you're able to set their admin levels. So the first person who creates the account is automatically the admin. And then you can assign people as admins or as workers. Workers have access to all the information in the site. The only thing they can't do is change the basic information under my program tools. So typically you want to kind of work through who's an admin and who isn't within your site, just to make sure that whoever is changing that basic information on your contact card really has the authority to do so. You can invite team members here as well. So if you see a team member that's missing that should have access to the site, go ahead and invite them. That actually expedites the process because FindHelp has already verified that you work for your organization. So they're allowing you to kind of vouch for someone else that works there. You're also able to deactivate people at any time. So if someone does leave your organization, you would just deactivate them. And then if they wanted to still have access, they would need to reapply through FindHelp through whatever new organization they land at. Okay, other tools here. So we've looked at program listings, we've looked at team. Let's get into some inbound referrals. So inbound referrals, it's going to log anyone that you are helping. So whether those people are being referred by you to another site, or they were referred by themselves or someone helping to you. And your programs are going to be listed here. We only have our demo program available at United Way for training purposes. So you'll see I've got 2 clients here. The status of their referral is going to be right here on the left. So you have a lot of options when it comes to the status of someone's referral. Are they getting the help they need? So best practice, I would say, is to set a reminder and just, on a weekly, monthly basis, whatever makes sense for you, to go in and make sure that all of the statuses are up to date. When you select one of the statuses, it's going to send the update to 3 different entities. So it's going to send an update to anyone on your team who's working with, he's my fake client, Jimmy Crisis, letting those people know that Jimmy got the help he needed. If Jimmy has a free account within FindHelp, it's also going to send him an email saying, congratulations, you got the help you needed, through FindHelpIdaho. And then it's going to send an email to the person who made the referral. So that's how we find that closed loop process. When you make a referral through FindHelp, you're going to find out anytime the status changes. So if they're not eligible, you're going to know that. Maybe you can follow up with the person and suggest another program, or you can refer them to another program directly through FindHelp. You can find out if there's not capacity at the program anymore, if they were referred elsewhere by the referral agency. So a lot of options here. And again, it's going to update all of the people who are involved with finding help for the client. It also gives some basic information here. So the language is spoken, how they prefer to interact. So email or text here, the date they were referred on, and you can set internal data collection forms on this internal page as well. So through inbound referrals, there are ways to create an internal data collection form. So we looked at the custom screener before. That form where people making referrals through the site would be prompted to answer some of those basic questions that would be sent along with their referral. The internal data collection form is something that your program uses after someone is already in your program referred to the site. So some of that secondary information gathering can be created as a data collection form through your inbound referrals. You're also going to see that the people you're helping populate under the People I'm Helping tab. So both Jimmy and Ivana Help are going to have profiles created under the People I'm Helping tab. For each profile, you can click on their name and see that you have a lot of information, ways to interact with this listing. So you can have their personal information, any goals that they have, referrals that you have made, if you want to assign team members. So right now he's assigned to me. You can share things within your group, add in data collection forms, and upload any documents that you need. So if we needed to gather something like bank statements or driver's license, something like that, you could upload the documents and have them saved here electronically. You can also add notes. So these are notes again for you or your team. I know for myself, it's just really helpful to have all this information in one place. A lot of times you'll see that, you're going through emails or you're checking this Excel and this form to try to kind of create a profile like this. So a really great free tool, and you're able to refer people to your own programs. So if someone walks in the door, you're able to refer them to your program through FindHelp, even though you work there. It's going to create this profile and you can use it to store all their personal information, knowing that it's HIPAA, FERPA compliant, and high trust certified. Okay. I'm going to pause for a moment and see if there's any questions. I feel like I am throwing a lot of information at you all at once. So I'll pause and take questions before I get into some of the personal tools that are available to you.
And I'm not seeing anything here in the chat right now, Anne, but if anybody has questions, feel free to come off mute or throw your question in the chat and I'll be happy to relay that.
Perfect. Thank you, Ian.
We've got one here actually from Teresa. The document uploading feature, can new documents be uploaded and replaced? Can they replace the old ones?
Yes. So if you're uploading a document, you would be able, let me just see if I can upload it here in real time. So you're able to delete that document out. So if you uploaded a new one, you would just delete out the old one. Okay, a few other tools available for you. These are called personal tools. So you'll see my name is over here in the right-hand corner. When I open my name up, I've got some tools that are available to me. The first is our saved favorites. So if you remember when we were looking at the program card at the beginning of the training, there was a way that you could save favorites to your favorites folder. This is where those are stored. So you're going to see I've got my personal folders here of my favorite resources. Let's look at our United Way partners. And it's going to pull in the partners that United Way helps fund. And it's storing them all in one place. So if I want to interact or check in on the listings of our partners, they're all going to pull right here. And then I have tools available to me. So I can share this entire folder with all of these great resources to someone through email, through text. I can share as a link. I can share with a group within FindHelp. I can make edits to my favorites folders. And then I also have that print function once again. So if I want to be printing this information, if it's a list that I print regularly, best practice is save it to a favorites folder. You're going to know that all the information is being updated on a 6-month basis. So we know in some communities or in some programs, they still like to have paper resources, especially like with our homeless population or in some of our more rural counties. This is a great way to save the programs that you interact with into a folder, print it off every 6 months, knowing that when you're handing it out in the community, that the resources are really up to date. Also, under your name, you have the Referrals for Me tool. So here you're going to see referrals that were directly sent to you or programs that you contacted. So this is the work that you are doing, not that your team is doing, not that your organization is doing. It refers to those direct referrals that were sent to you or that you sent to another organization. So you can easily look at the status of those and track the process of your work. You also, settings is just about if you need to reset your password. So I'm going to skip over that one, but search history. So this is going to pull in some data analytics. It's going to show you your personal search through FindHelpIdaho. So you're going to see some great information here, zip codes that you are looking in, the biggest areas that you're searching. So housing, is a big search right now. People are looking for help. Food insecurity, we know, is another big area. So it kind of helps you see, if you're in a navigator role, what people are coming to you searching for. What are you helping people with the most? And reports like this are great when you're looking to talk to community members, when you're looking at grant funding, when you're interacting with your board of directors. It's just going to pull in a lot of good data that you can share about the work that you're doing. It's also going to show you the referrals that you sent and the referrals that you've received, and all of the information populates for the last 90 days. Now, if you're looking for even more information about the data, you can go under My Program Tools and Program Analytics. So this is going to provide the reports that we know people are looking for the most. So you have a screener report that's going to pull in information for those custom screeners that you can set up for free within FindHelp. You can interact with data from your claim dashboard. So any programs that you've claimed, you can view a report on how people are interacting and accessing your programs through FindHelpIdaho. You have your activity dashboard, which is going to show information about recent activity in your zip code, search trends in your area. So what are people looking for? And then your organization's data collection. So that refers to everything that your organization is doing, no matter who is interacting, making referrals. It's going to pull all the information into one place. So I'm going to show you the search trends in coverage area. Again, I'm in a demo program, so some of my reports don't have as much robust information, but you'll see, just like the report that I pulled under my personal profile, it's showing really great data for the last 90 days. How many searches were completed in my area, what areas were they looking for, the biggest search terms that people are looking for. So this, again, is really helpful information if you're trying to start a new program, you're looking for grant funding for the program, you're looking for board support. You can show this is something that people are searching for, this is a need in our area. And those reports that you see under the data analytics, they're listed here because they're the reports that get requested the most by FindHelp. If there are specifics and data that you need pulled for certain, again, like funding requests, or if you have certain parameters and goals that you need to meet as an organization, any data can be pulled out of the FindHelpIdaho database. You would just email me to make that request, and I'd work with the Idaho Health Data Exchange and the FindHelp data team to add in those specific search terms or areas of need and pull out that data for you. So just know, the more information you put into FindHelp, the more you're using the tools here, the more information you can pull out, and all of the reporting is going to be presented in those really nice graphs and charts and all of those nice visuals that people are looking for. Ian, I see we have a question.
Yeah, we have another question here from Eric. Is it possible to run a report to show demographic of clients served, specifically limited English proficiency, language spoken, or any requested accommodation for a disability?
Yeah, absolutely. So in a specific case like that, I would recommend a screener form. So that might be one of the internal screeners. Once someone's already in your program, there would be a screener form that asks that specific set of data questions. Once that form's created, it's going to populate under My Analytics, under Data Collection Reports, and you're able to view the report, and it's going to provide all of that information for you for a 90-day period. Any additional questions?
Not seeing any others in the chat. Oh, we had one come in actually. Can it be longer than a 90-day period?
So if you're looking at data for more than 90 days, that would be a special request through me and the FindHelp data team. It's not impossible. We can definitely pull information for longer data sets. The 90 days is really what can just be loaded easily through the free dashboard. Okay, I'm going to jump back over to my presentation if there's no other questions. So I wanted to talk a little bit about the growth of the program in Idaho. Our first collective meeting was in 2021. So this was a resource that started in the pandemic. We saw that people were really searching for resources, really looking to connect to programs that could serve their needs. So Idaho Health Data Exchange started our collective. Again, if you were here at the beginning, you saw all of the great organizations like the United Ways in Idaho, Idaho Nonprofit Center, the Idaho Food Bank. We're all partners of FindHelpIdaho.org. We started our first collective meeting in 2021 to really target how to grow this data platform and make it relevant for the people in Idaho. And you'll see the claimed programs and connections made has just gone exponentially up since that first collective meeting. So we continue to grow the program. Like I mentioned, the official launch date of Find Help Idaho is actually April 6th. So you're getting the sneak peek here. As you are interacting with the site, please feel free to send feedback my way. We're continuously trying to improve it and make it really work for the people in Idaho. So if you're noticing things like this language is confusing, we're not seeing enough mental health resources or something like that, please let me know and we can try to adjust that, make the database more robust, whatever we can do to have it serve you the best. So here's my call to action for all of you on the call. So the first is to search for your program in FindHelpIdaho.org. If your program is in the network, go ahead, claim your program, get started making any edits that are needed to your program cards. And oftentimes one of your programs might be listed, but remember, you can have a program card listing for every single program that your organization offers. So take advantage of it. You want people to find the programs that you offer. You're going to claim the programs and then start using Find Help to share resources and to log referrals. So whether that's using the resource when people come to you so that you can create that free profile for your clients, or whether it's just providing people with the information of Find Help Idaho when they're seeking services outside of your organization, we just hope that you'll help us get the word out about this resource in our state. If you are still using paper resource manuals or you have a great Excel sheet with a lot of good resources, if you could please email me that resource guide, I can get it uploaded into Find Help Idaho for you. So instead of you going in and typing each resource one by one, I have a way to actually upload it as a batch, and I would be happy to assist you in doing so. And then finally, feel free to schedule a workplace training. So if you felt like the tools that were shared with you today are really beneficial to your organization, I'm happy to schedule a virtual or in-person training if you're in the Treasure Valley to come out and share more with your entire team, walk you through some of the processes of how to get everything set up and running for your organization. So my contact information is there to the right. Please email, call me. I'm happy to help you. And I am going to open it up one last time for questions. That is the end of my presentation. So we'll take questions and then you might get just a little bit of break before your next afternoon meetings.
All right, and we've got one question in the chat here and a lot of thank yous. This was an awesome training. Let's see, so from Tiana, is there